Welcome to Voices in Nursing with Dr. Nozil, where we amplify the voices of those shaping care, leadership, and health policy. Today's episode is Call to Action.
On February 24th, 2026,
Nurse practitioners from across the state of Georgia will gather at the Capitol for UAPRN Day at the Capitol, not just to be present but to be heard. At a times when Georgia faces persistent challenges in access to care, workforce shortages, and health equities, nurses practitioners are uniquely positioned to offer real evidence-based solutions. Yet, policy decisions that directly impact patient care are often made without the voice of advanced practice nurse at the table. This episode explores why nurse practitioner must engage in legislative advocacy, why showing up matters, and how our collaborative presence at the Capitol can influence policy that expand access, improve outcome, and strengthen Georgia healthcare system. Today, a nurse leader, an advocate, and educators in the community to clear things for us. Before we do, I'm going to have her introduce herself. Hello, see, how are you?
Hi, so I'm Shelly Ann McKenzie. I am a registered nurse. I have spent 28 years in healthcare. I hail from New York. I've moved to Georgia back in 2008, relocated to Georgia, and I've worked in a number of spaces in healthcare. You mentioned I'm an educator. I've worked clinically at the bedside. I've also worked in nursing informatics, project management, worked in a number of leadership roles, and I'm also the founder and CEO of Help for Healthcare Professionals. So, we are a nurse led nonprofit that supports healthcare workers and first responders. We're based here in Gwinnett County, Georgia, and we support them through our crisis relief, our education, and our advocacy efforts. So, advocacy is a big component of what we do with our nonprofit. We've been able to impact the lives of over 25,000 healthcare workers and first responders since we started in 2020 in COVID across 26 Georgia counties and most recently the island of Jamaica. So I am proud to sit here with you today wearing three hats. I'm a member of United Advanced Practice Registered Nurses of Georgia. I am not a nurse
Okay.
practitioner, but I'm a proud member of UAPRN, standing in the gap for all advanced practice nurses. I'm also an ambassador for the Georgia Commission on Women, again, a CEO of an organization that's built to ensure healthcare professionals in this state are seen, supported, and sustained. So these are not separate roles, it's
Mhm,
one mission, and just making sure that we are all here to be seen, not just seen, heard,
mhm.
making sure that Georgia's listening to those of us who have something to say, and not just
Yeah,
nurses. We have something to say. So hopefully Georgia's listening.
you're wearing a lot of hats. Dr. Nelson will say advocacy 101 is stand up, show
Show
up,
up.
and speak.
Definitely.
So, the role of a nurse practitioner in addressing access to care and the role in understanding underserved in Georgia. Let's talk about that a little bit.
Okay, so when you look at it, Georgia's projected to have a shortage of over 8,000 physicians. So we have counties in Georgia,
Mhm.
143 of them are designated as healthcare professional shortage areas. And we counties that don't even have a doctor at all. They don't even
Wow,
have no physician. So one third of Georgians, which is approximately 3.3 million people, don't even have access because they live in one of these professional shortage, the primary shortage areas that I just mentioned.
which is the suburb?
Yes, the 143 counties are designated as the professional shortage areas, the healthcare professional shortage
Wow.
areas. So that's 3.3 million people live in one of those particular areas. So if you look at it this way, when A physician is about 45 minutes away, if one even exists at all. A nurse
Mhm.
practitioner is there, not necessarily supplementing care, right? Because supplementing means that they're there in addition to. Sometimes the nurse practitioner is the only care, right? So nurse practitioners can diagnose, they can treat, they can prescribe, and they can manage the chronic conditions for populations like these that would otherwise go without. And then research shows that nurse practitioner led care is comparable to physician only models, especially in chronic disease management and preventative care. So, when we talk about health equity in
Yeah.
advanced practice workforce, it should be the headline. It shouldn't be just another footnote or somebody trying to brush it underneath the table. It should be the headline because advanced practice nurses are definitely a way to solve for this particular
This, yeah.
issue in rural.
And is there any nurse practitioners that is on the rural area also?
Yes, nurse
Do
practitioners. Yeah, nurse practitioners definitely serve in a rural area. And we could probably talk about it a little bit more in this conversation. I know this is a quick chat, but in terms of full practice authority, we can go there in a little bit. But Georgia is one of about a dozen restricted states. So we do not have full practice authority. To answer your question, we do have nurse practitioners in these rural areas, but then of course they have to have a collaborating physician, and there's so many different layers that they have to go to be able to provide the care that the Georgians need, regardless of what area they are, because the entire state is, we do not have full practice, and that is definitely something we need in Georgia. Full practice authority, which would allow nurse practitioners to practice independently without some of this other red tape and barriers.
okay. Oh boy. Can you tell me why nurse practitioners' voices is matter in the legislation decision affecting scope, reimbursement, and patients' access?
Okay. The thing is, we are here to be the voice, right? Legislators are making these decisions about scope of practice, Medicaid reimbursement, parity, and telehealth policy, and all of that type of stuff. So those decisions actually determine whether a diabetic patient in a rural county gets managed properly or ends up in an emergency room because they didn't have care to begin with. And
Mhm.
then, of course, those the critical access type of hospitals in the rural area, their doors are closing, right? So they can
Yeah,
barely keep
yeah.
their doors open. So they're already struggling. So when you have a diabetic who's just not being treated properly, end up in the
Mhm.
emergency room, that's posing a strain on the healthcare, the ecosystem in general. So
Yeah.
when you look at it, nurse practitioners are not just, it's not just theorizing about the impact and whether we can do the job or not, but we are living it every single shift. I say we because I'm like I'm a part of UAPRN, right? But
Mhm.
nurse practitioners, every single shift, every single home care visit, every single thing that NPs do, if they don't have a seat at the table, then policy gets written without the voice, and
Mhm.
then policy gets written around them versus actually having them be involved, and then patients are the ones who ultimately pay the price, right? So that's why showing up at the Capitol is not optional, it's essential. So nurse practitioners need to be a part of that decision making and need to make their voices be heard, primarily to educate
Mhm.
and provide the awareness that these legislators need when they're making those policy decisions.
Yeah. How do we translate experience into policy impact?
Okay. So, if you think about the things that we see at the bedside, for example, whether you're nursing now, you nursed 10 years ago, patient that drove to a hospital, right? You drove 2 hours for a follow up because there was no doctor closer. For every
Mhm.
mother that may die, literally, because we're in Georgia. And,
Yeah.
and and we have maternal mortality issues and everything like that. So for every mother that may have died because they couldn't get to the doctor, or the child came and then the mother died and things like that, or you have families that are rationing out their insulin medication. If you think about insulin,
Mhm.
something that a lot of diabetics need. So for a family that's rationing out insulin because they can't afford to go to their appointment, they're breaking pills in half and doing all this extra stuff, or just even a child who may happen to fall through the crack between like a school nurse referral and a specialist who
Mhm.
don't accept Medicaid and all those kind of things. These are not just random anecdotes or whatever. These are like the data points that never make it to the legislators when they have their bills and their legislation to pass. They don't get these side notes, so they don't even know how to apply it. So it's our duty to translate all this bedside experience into policy impact by providing that education and providing the awareness. So our job here today is just to do that, translate what we witness into language that will move policy. Once we educate them and provide the awareness, they will be better equipped to write the policies, right? So
Right,
after
right.
after being in this thing and dedicated over 28 years to clinical practice, this has not like limited my credibility in this space. Like it is what has built where we are today. I didn't know I was going to be a nurse advocate. I didn't know
Yeah, yeah.
I didn't know I was gonna to have a nonprofit that supports healthcare workers and first responders. So every healthcare professional that is standing on the step has the credibility. And that is why we all need to show up to places like the Capitol and make our voices be heard and turn on that advocacy lens as well and do what we need to so our voices can be heard collectively. Make a bigger
Yeah.
impact.
The scenario with maternal childbirth, that's scary.
It is.
Imagine it is not something that can wait when you have a mother in labor and there is no care around.
Zero care.
Is zero care. What the mom can die, baby can die,
Both can die.
both can die. The mother greater risk. And then that's chilling. So I know right now we in February, there was a lot of activities that's going on right now
Mhm.
at the Capitol. Can you tell us? Let's talk about that.
All right. So there are lots of activities for those who are interested or those who want to get interested in advocacy work and showing up. If
But you
you
know what? I would think every nurse, not even nurse practitioners, I'm sorry to cut you off,
No, no, I was going to
but
say every nurse.
everyone, healthcare impact
It's for
all
everyone.
it's for everyone.
It's for our
I'm sorry.
community.
Go ahead.
No, no, no. It's
Finish.
definitely for our community. Again, every voice needs to be heard, nurse adjacent, because it strengthens our communities. Everyone needs access to healthcare. So at some point in your life, your loved one's life, there's death, dying, sickness, illness, new diagnosis. Everybody is one step away from needing some kind of healthcare. You could have a random car accident, it could be anything like that. So everyone needs to be present to help educate using your lens and help educate the legislators. And guess what? They're open to it. Many of them are open to it. That's the thing. A lot of people don't even know they're legislators. They know that they're policymakers or people, or you don't trust politicians, and but you need to get to know them. Get to know them, get them to know you in return, right? So it's a two-way street. If you don't know how to find your legislator, you can go on legis.ga.gov and you can find your legislator. You put in your zip code, you find out who your legislator is, so that when you do come down to the Capitol, you find out where their office is, and then you can go reach out to them. A number of them on their website, they have like a contact us. So if you have something you need to talk about or whatever, they're listen, you are the constituent, right? So they are there working for us. So at the end of the day, if you don't know your legislator, you can find out who they are and you can go talk to them. But to circle back to the question that you asked about legislators or whatever, but
Yeah.
Tuesday
Oh,
is
before we get to that
Tuesday.
discussion, before we get to Tuesday, there are a lot of people that've been saying they don't want not in politics. They're not gonna vote. They're not gonna do anything like that. They have no interest because they don't believe they
To
lost
change.
trust or don't believe on the voting system here.
Mm-hmm.
What do you think?
It's not even what I think. I still think we have a responsibility, and it is critical, it's crucial that we vote. It's something that we need to do regardless. And the more of us that keep showing up and showing up to the polls, we can definitely make change. And I mentioned before that the collective change, right? So the more of us that keep doing it, because for everyone that says, oh, I'm not voting and I don't care and that kind of thing, it's almost watering down the strength that we can have if we were unified. You see what I'm saying? So people to go out and vote. I still, I'm like, listen, we will pick you up and take you. We will get Uber to come and get you to take you to vote because it is something that right, historically, the ancestors, everyone was fighting for us to be able to vote. So
Okay.
admit the minimum thing we can do is get up and go and vote. Some people don't go out to vote. Oh, it rained that day. People have all sorts of excuses. Again, if we all go and vote and stand unified, stand in unity, we can still make change. And people have to understand it's not a short-term thing,
Mhm.
right? Especially when you're advocating for policies or you're going down to the Capitol and you want to see change made. It's not an overnight thing. So don't get discouraged if you and then something doesn't get passed in one particular. There are bills that have taken years to pass, like
Okay.
years on end, but it's almost like an ongoing thing. So once you get that mindset and you know that it's something that's ongoing and you're not necessarily going to change a process or a policy, just like everything, you could be at work trying to change a policy or trying to make a transition or a transformation in any organization that you would. None of it happens overnight. So change takes time. So
Mhm.
I would still say show up, vote, make your voices be heard, listen to the candidates, right? There might be something that resonates with something that they're saying that might resonate with you, or might resonate because something happened with one of your loved ones or somebody in your individual, your camp. And
Yeah.
then that might have you lean towards one person or another. We at Help for Healthcare Professionals, we support the different healthcare professions. So not only
Mhm.
just the nurses, the nurse practitioners, the doctors, all of them, because everyone has their legislative priorities, the licensed professional counselors, any one of the healthcare professions. We're here to support them all. But when it comes down to it, we know that nursing is the most trusted profession for
Yes.
23 years straight. We also know that there are 5 million nurses in the
Mhm.
country. So at minimum, if we even band more together, even in nursing, because a lot of people in nursing we're siloed as well, right? The
Mhm.
different specialties, the nurse practitioners over here, the nurse anesthetists over here, and that kind of thing. So the goal is to come together and continue to be unified so that our voices can be heard, so that we're telling the same story. One of the legislators had mentioned a couple years back, they were saying it's so hard to follow the story because we're not
Mhm.
unified. So
Yes.
we need to make sure the script is the same. We're
Yeah.
all using the same talking points. That way, they'll start listening more because it's not a scattered message. So they'll start
Oh.
listening more.
So, what do you want the viewers know about
Tuesday.
Tuesday?
So on Tuesday, I need you to come and meet us on the south steps of the Georgia Capitol for a full day.
Mhm.
Together, you'll have three powerful movements. So, Help for Healthcare Professionals, my nonprofit, we're having our HHEP Day at the Capitol. That starts at 9 o'clock. Then,
Mhm.
Georgia Commission on Women, we have our Champions for Change event where we're giving out awards to certain individuals that are championing change across Georgia, and then Nurse Practitioners Days at the Capitol. So we've planned it so that everyone can come out. It's flexible, right? Depending on
Yeah.
your other priorities, because I know people will have competing priorities. But from about 8:30 in the morning to about 3:30 in the afternoon on Tuesday, February 24th, we'll have a full day, and it'll be a full day of impact. So come, make sure you allow ample time to come through security, bring your state issued ID, because there's no exceptions for that. That's not
Mhm.
our rule, and you have to do that to get into the Capitol. Wear your lab coat, your scrubs. We have royal blue for nurse
Mhm.
practitioners or anything like that. We're royal blue in solidarity so that we show up as a one unified force. So that's the South Steps, Georgia State Capitol, 206 Washington Street, Southwest in
Okay.
Atlanta. If you try to put it in the GPS, it might come up as Georgia Capitol Museum. It's the same thing. So it's this Tuesday, so we hope to see you there.
How does parking?
Parking is pretty special. What
Okay.
we parking, you can park at the Sloppy Floyd building. They have adjacent within the perimeter, so within a couple of blocks, there are some churches that you can park on and walk over to the Capitol. Sloppy
Okay.
Floyd building has a big giant parking garage that's connected, and you could walk through and you could get. So parking definitely can be a challenge. So just give yourself some time to get through Atlanta traffic, get down to the Capitol, so you can park and walk over. But they're like, I'm from New York City, so they're like New York City, like short blocks, right down because you're right downtown, so you can get where you need to get from there. And there's more information related to all of that on our website, helpforhealthcareprofessionals.org.
I will encourage everyone. You don't have to be a healthcare provider to show up
Anyone.
and support the nurse practitioners and then support the UAPI and then give your voice because we have to make an impact
Hmm.
on that day.
Yeah, we need them to hear us.
So we need to come. Can you tell them the address again?
The address is the Georgia State Capitol. It might come up as Georgia State Capitol Museum, but 206 Washington Street Southwest in Atlanta. And we will be on the South Steps.
Steps.
From
All
about
right.
8, if you can come for an hour, come for 2 hours, whatever you can come for, just show up at the Capitol because we have to show up.
Sometimes you can see the legislators in your area.
Yes.
It's good to know. Sometimes legislators stop and start talking.
Yeah, meet them in between, meet them in the hallways. It's not only a photo opportunity where you put them, if you have a something you want to write down so you could slip it to them when you meet them because they still have limited time as well. The session will be going on at the same time. You might have to be in the session. They'll come out to say hi, that type of thing. So if you have something you want to write down, that's a strategy. Write it down
Yeah.
or type it up. Make sure your information is on there. You could slip it to them. They could look at it later. If you're an organization that wants to come down and support, make sure you just have a one pager, just something that you
Yeah.
could drop off in their office. And when you see them, you could say, hey, I'm dropping off something in your office because their staff is still in their office. So they might
Yeah.
be tied up. They might can see you for a second. But if you don't know your legislator, again, www.legis, legis, www.legis.ga.gov, and you could find your legislator there.
Yeah, Shelia, thank you very much for coming. Thank you very much for taking the time to give some information to our viewer. And then I hope we can come in next time or we meet next time
Yes,
to
in
have a little
person.
more sessions in person so we can share any good information that you can share with our community. And I
Definitely.
thank you very much for listening and thank you for watching. And I will see you on Tuesday at the Capitol on the South Side. Am I correct?
Yeah, the South Steps on the South Side. Yes,
Stop
February
steps on the
24th.
South Side. February 24th, 2026. That's going to be a Tuesday. Thank you. Let's learn, let's lead, and let's shape healthcare together.
Mhm.
Thank you.